I'm delighted that you have chosen to spend your time with me here this evening. For many of you, if you're on the West Coast, I suppose, or East Coast. But it's been such a delight having people from Australia, the UK, all over the world join us for coaching calls, for Zoom webinars. It's just there's such a testament to this powerful community. So thank you for being here. The reason why I wanted to dive into the science of Alzheimer's is there's a handful. So one, we have some really exciting new research out there. And I think a lot of you have maybe seen, if you're on our mailing list or if you participated in the summit, you might have seen that we published in the Journal of Alzheimer's Disease, my research team and I, a study recently. So I wanted to go into some of the nitty-gritty around that, describe the study design and our outcomes, but also put it in the context of other Alzheimer's research. There was a great question that just came in on the Q&A that essentially asked the question that I want to answer today, which is, if you have family members that consider Alzheimer's not to be curable, when the message is so strong that there's nothing you can do about it, what do you say? How do we have conversations around that? And my job, as I see it here, is to change the narrative around Alzheimer's and what is possible. Now, I would agree there is not a cure for Alzheimer's, but there are lots of treatments that can help it certainly be prevented, and in many, many, many cases be reversed. So I'm going to get into all of that, just a couple of logistical pieces. This webinar is being recorded. And so don't worry if you're coming in late or if you have to leave early, because you signed up for it, you are going to get an email with the replay. So you'll be able to access that, no problem. Those replays will be available in about 24 hours. So you'll be able to see that. And please go ahead, start adding questions to the Q&A at any time. That's where I'm going to go first at the end of this conversation. And I'm just going to start at the top. So please send your questions and I'm more than happy to answer them. I've dedicated my life, as I said, my professional career to reducing the suffering associated with Alzheimer's and dementia. And I have come to believe, after overcoming skepticism, that Alzheimer's is optional. And really what's standing in the way of people choosing to not develop Alzheimer's or other dementias is the support that you need to implement Dr. Bredesen's protocol. So Dr. Dale Bredesen is my mentor. He's published prolifically in the Alzheimer's research, as have other people on his team, including Kat Toops and Ram Rao. And this is his original book, The End of Alzheimer's, the New York Times bestseller that was launched in 2017. And that was when I had the good fortune of working with Dr. Bredesen. And what we've seen is, as we've explained, as he's a neurologist and he explains the science very eloquently, he has been in this space as a researcher, as a medical doctor for many, many, many years, for decades. And he's really paved the way for me to be in a position where we can offer you a lot of support that's necessary to basically implement a somewhat complex protocol. So we'll get into some of that. So again, here's a photo of Dr. Bredesen with me. Really, my clinical path, my career path has been really because people have asked. I've had patients who have come in and said, hey, I need this support. What is out there? What can you refer me to? So originally, when I finished naturopathic school, I had been told that there, like many of you, like many of your family members who you might be discussing this with, I'd been told there was nothing you could do about Alzheimer's or dementia. And by very, very smart people, they said, don't suggest otherwise. Even with all of our naturopathic tools, there's nothing we can do to reverse this disease. And to suggest that we could would be to give people false hope. So I went into conferences believing that to be true. You know, everyone I trusted had told me that. People who had lots of clinical experience, were very, very intelligent. That was who I had learned from. And then fast forward a couple years out of training, I saw a talk by Dr. Bredesen at a medical conference, and he was reporting that there were cases of people reversing their Alzheimer's. And the way he described it made a lot of sense to me, because it took a complex disease and it gave it a solution that matched the complexity of the disease process. It really said, if we stack everything that we know about naturopathic and functional medicine and we put them together, what we see is this synergistic, virtuous cycle of effect on the neurons. And we actually see some repair and some improvement in cognition. And so after training with him, I started to have, even though I was still skeptical, I hadn't seen this actually happen, right? There was a lot to overcome in terms of the skepticism. But after being trained by Dr. Bredesen, I realized I had a lot of the tools in my tool belt after naturopathic training, and I really just needed to apply them to people who are suffering with dementia. And so I had people showing up in my office. I've shared many of these stories. I hope you've heard them, but it really was miraculous what I saw, how people with severe dementia were turning that around, regaining some cognitive function, not necessarily going back to work, but certainly improving quality of life, improving their connections to their loved ones. And that was so miraculous to me. I couldn't imagine spending my time on anything else other than telling people that it was possible, because so many people are still told this false narrative that there's nothing you can do. And so when I saw what was possible for my patients with severe dementia, I of course thought, what's possible for all of those people who don't have dementia yet? Can we prevent a lot of the suffering? Is a lot of the suffering associated with Alzheimer's unnecessary? Also, through my process, I had people approaching me and saying, hey, I love Dr. Bredesen's ideas. I totally get the concept. I read the book. I love it. How do I help my loved one implement this? I just don't have the capacity. I am raising kids. I am working full time. I have a relationship I need to make sure doesn't end up in divorce. I've got a household to manage. The thought of bringing my uncle or my dad or my mom into my house to drop everything and cook for them and create a nurturing environment and activities that engage them, it's just too much. I can't do it. Where can I send them? And that was how Marama was born. So Marama is an immersive experience. And this is, Dr. Bredesen is there. This picture is from our opening there at Marama in February of 2020, right before the pandemic shut everything down. We got to celebrate the opening, and it's this place where the idea is really memory recovery instead of memory care. The goal, the very lofty goal that we hope to achieve, is that when someone moves in, they can move out and live independently, that we can delay the need for memory care at the very least, and maybe even not have to go down that path. So that's the goal of places like Marama. And then we've also started, because of people reaching out and saying, hey, I don't want to move my loved one across the country to San Diego to be by you. I want them by me. So we've also created Marama at Home, which is a caregiver training course. And we're happy to answer questions about that. Tyler's here with us. So if you have questions about logistics or anything like that, please put in the chat directed at Tyler and she'll answer them right away. So this is Jan. Jan moved into Marama in 2020, just to give you a sense of what is, again, possible. Jan and her husband moved in, and when she moved in, she was struggling to remember things. Her daughter was living up in LA and coming back and forth and frustrated with her mom. She wasn't remembering to, she wasn't remembering to take out the garbage cans, and she didn't remember to meet the roofer to fix something that was coming up, or the plumber, and things were kind of spiraling. And COVID had hit. And so they were isolated in their home, and both of them were struggling significantly with memory loss. So they moved in 2020. And when this happened, I would take my daughter to Marama. When we first started Marama, it was in December, and she was about a year old, and I would take her and I'd have her on my hip, and I would walk in and out of the rooms with the hospice residents who were living there. But by the time Jan moved in, COVID had hit. And so my daughter was always outside, but she would still come, and her dad would be helping me with things around the house, and she'd be outside. So Jan knew I had a baby, and I'd walk in the house with my mask on, and she'd say, oh, you have a baby. Is it a boy or a girl? Oh, how old is she? And then she'd start to tell me about her daughter and raising her daughter. Well, then a couple minutes later, she'd say, don't you have a baby? Is it a boy or a girl? Oh, what's her name? How old is she? So very thoughtful, very kind, very sweet and inquisitive, but forgetful. And her own daughter would be frustrated, because she was asking the same questions over and over. Well, fast forward to recently, I was out there, and Jan says to me, hey, Doc, how's Nadia? She must be about 4.5. Is she riding her bike? When I was raising Lauren, she was riding her bike around 4. So Jan has her memory back, and her daughter has her mom back. But Jan finishes her daughter's sentences many times. And that connection to me, the memory of my daughter's name, the details about how old she would be. I mean, would have been an impossibility 3 years ago, but she's made so much progress. She is such an impressive example of what's possible. And I remember reaching out to Dr. Bredesen maybe 18 months ago or so and saying, is this like this woman, she seems to just keep getting better and better. I thought she would plateau at some point. And he was like, no, of course she's getting better. The toxins are out, the nutrients are in, she's getting the support. And there's this, again, this virtuous cycle of continual improvement. Now she's getting older, she struggles with other age-related issues, but her quality of life is there and her memory is there. It's not perfect, but it is certainly better than when she moved in. And so it's an inspiring example of what's possible when you put the Bredesen protocol to work. So what we're here to do tonight is talk about the science. And so the Journal of Alzheimer's Disease, which I'm going to refer to a lot tonight because that's where both the Bredesen team and I have both published. And Alzheimer's is preventable, and we're seeing this from very reputable journals. So the Lancet and also the Journal of Alzheimer's Disease are two places where we're seeing this kind of shift in the research away from this beta amyloid plaque hypothesis and these sort of surrogate markers, right? They're markers not of cognition, quality of life, or the things that really matter to people and their caregivers, but so away from these surrogate biochemical or pathophysiological markers and towards the things that are more patient-centered, more important to patients. There's a wonderful book that I'm going to share quickly. It's called How Not to Study a Disease, The Story of Alzheimer's Disease. And it's by a gentleman named Carl Harub. And it is, I read it on one plane ride, but I hope that there's nerds amongst us here tonight because I consider myself one. And this is the type of thing that I will just devour. It's the story of how there were essentially, the way Dr. Harub describes it, there were these three elevations of the beta amyloid plaque hypothesis that were really marketing plays, not scientific ones. And they have been designed to essentially get more money for people or agencies or pharmaceutical companies along the way. And it's led us into this sort of echo chamber of just thinking, if you're not studying amyloid plaques, you're not studying Alzheimer's. When really what we want to be studying is, how do people get their cognition back? How do people get their memories back? How do people get their connections with their loved ones back? That is what is important. And so that's what we are shifting our focus on. And I just commend the Lancet and the Journal of Alzheimer's Disease because they are helping to shift this narrative, to shift the focus away from just the drumbeat of how do we reduce amyloid plaques towards how do we improve the lives of patients. And can we find and incorporate these multimodal interventions that are going to meet that complexity of the disease. So this is from, hopefully this is blown up on your screen because it's a fun graphic that came out of the Lancet. So the Lancet in 2017 and then again in 2020 updated their commission report on Alzheimer's and dementia. And so what they reported was that there were modifiable risk factors that could potentially prevent up to 40% of worldwide dementia cases. This is a huge amount of the dementia in the world. Today, there's 6 million people in the US suffering with Alzheimer's. If we could get rid of 2.5 million of those, that would be incredible in terms of reducing the suffering, reducing the cost and expense, connecting people, getting the value and the benefits of having that older generation still engaged with their grandchildren and at work and whatever it is that gets them excited. So what are these modifiable risk factors? You're going to hear more and more about these from me, and I think of them slightly differently, but they're really important to go through, and there's a ton of research that supports this. So the first thing is less education. Now, some of these are put in sort of a negative way, right? If you have less education, you're at higher risk for developing dementia. This means cognitive reserve is another term that we say. This means the more education you have, the more those connections are there. And then when there's some pruning later on and you have fewer connections, you have more reserve, you have more capacity there left. How can you combat this? No matter where you are in life, you can keep learning. Be a lifelong learner, always looking for new things, whether it's a new sport, a new exercise, a new It's 2020. If you just Google, Dr. Monique, if you just Google Lancet 2020 Commission Report on Alzheimer's, it'll come up right away. And so then as we go through midlife, hearing loss, traumatic brain injuries, hypertension, excessive alcohol consumption, and then overweight, obesity also contribute to cognitive decline. Hearing loss is 8% of this, a huge part of that. So making sure, I have uncles and I was giving them a hard time this year when I saw them on vacation. They were not putting their hearing aids in. They would just leave them at home and not wear them. And I thought, oh my gosh, this is putting you at risk for dementia. You've got to wear those hearing aids because if you don't use it, you lose it, right? If that auditory information isn't coming in and hitting not only the ears and the membranes in the ears, but if it's not going to that part of the brain, the auditory processing centers of the brain, they start to atrophy. And so we want to make sure that we're getting those auditory inputs. We are the sum total of everything that comes in, whether it's our food, the smell, the visual stimulation, and also that auditory stimulation. So really, really important. As we go on later in life, additional potential risk factors include smoking, depression, social isolation, physical inactivity, air pollution, and diabetes or uncontrolled blood sugar. Right? So a lot of these sound familiar. And what we're going to do is kind of flip this on its head and talk about, okay, what are the interventions then? What can we do when we think of all these things that are going to put us at risk? How can we use these to our advantage? How can we optimize blood sugar, reduce toxic pollution exposure, increase physical activity, increase social connection, increase mood or enhance mood? Again, with smoking, this is essentially toxic exposure. With obesity, this again is going to be blood sugar management, exercise, diet, lifestyle. Same with alcohol and hypertension. Hearing loss is very direct, and I would see sleep apnea. I'm surprised that sleep deprivation and sleep apnea isn't on this list, and I suspect that it will be in the future. The other thing I expect them to add when they update this commission report is the consumption of highly processed foods. I think that that is also a risk factor when it comes to developing dementia. And so everything that we do in terms of our interventions hits each of these and then adds some. But the point I want to make with this Lancet article is really that there are very conventional, the Lancet has been around for 200 years, it's out of the UK. It is a very conventional, very reputable journal that says 40% of dementias worldwide can be prevented. That's a huge number. And it doesn't say anything about beta amyloid plaques or using Aricept or Namenda or any of the other medications, the pharmaceutical medications that are out there. This is just through lifestyle modification. So really very, very, very empowering and really important to understand. Okay, I want to introduce the MoCA because this is how we test, right? This is where the rubber meets the road. This is how we test cognition, put a number on it so that practitioners can communicate between each other so that we have an understanding of approximately where someone's cognition is. Now, that's going to leave a lot of details out of about the individual, but it still gives us an understanding of where someone starts, and we can measure, are they getting better or are they getting worse? And so I want you to understand a little bit of what a MoCA score is so that I can refer to that as we go through these slides and as I talk about the research. It's a single page worksheet that can be done by a provider, either any sort of medical provider or a tech, somebody who's been trained to do it. There is, if you're interested, if you're a health coach or if you're another provider who's here, thank you for being here, for one. And also, it's pretty easy to learn to administer the MoCA. And it takes 15 to 20 minutes, depending on someone's cognition. It's out of a total points of 30. So a 30 out of 30 is perfect. You may have heard one of our presidents at one point say that he had perfect cognition. This was the test that he was talking about. He scored a 30 out of 30 on this. This is not particularly sensitive for cognitive decline. So what we're picking up here is measurable cognitive decline, and below 26. So 26 and above is normal. As we move down the scale, so in those low 20s, that's when I have a ton of confidence that we can actually help people, and relatively quickly. This is where a lot of, we'll go into the MoCA scores of the studies, but a MoCA score 18 and above, I'm like, all right, we got this. We're good. We can get that cognition back typically. If it starts to drop below 16, although my confidence goes down a little bit, I will say that I still have hope, because I've made the mistake of not having any hope for people with MoCA scores of 0 and 2 and 8. And I have repeatedly watched them improve. Not every time. It takes more work, it takes more effort, but it is possible. I have seen it over and over again, as have many of the other people trained by Dr. Bredesen. So we use this, again, it's on that scale of 30, below 26 is measurable, it starts to be measurable cognitive impairment. As we get into the low teens, this is when people are needing support with activities of daily living. They're unable to live independently. When you're below 10, it's even more severe, typically needing support with and maybe toileting, certainly with eating, short-term memory loss. And although it can manifest a little bit differently for different people, there's of course mood changes, potentially circadian rhythm, difficulty sleeping, and things like that. And so I recommend repeating these every 3 to 6 months. We see changes in just 3 months often, but it's a way for us to, again, to know, is somebody getting better or worse? So this is a comparison. So this comes from Dr. Bredesen and RECODE or Apollo. So Dr. Bredesen's work, the RECODE program is something that you can look into and that's available to anyone suffering with cognitive decline or looking to prevent it. And what's going on here is that this is a comparison in what the expected MoCA scores are over the course of 12 months. So change in cognitive performance over 12 months, you are expecting a decline of about 3 points on a MoCA scale. Or there also is the SLUMS and the Many Mental Status Exam, and those are all 30-point scales testing cognition. And so on a 30-point scale, you're expecting about 3 points of decline in terms of cognition with no intervention. And interestingly, both Aricept and Namenda, or the generics are Memantine or donepezil. Those medications, when taken over time, they're actually associated with reduction in cognitive decline over 5 years. That is more than without treatment. So there's an even steeper decline. Now, if you're on those medications, do not stop them, because that will lead to an even steeper decline. However, talk to your doctor thoroughly, and there's a JAMA article, the Journal of the American Medical Association, that compares people who took those medications versus people who did not ever start them. And those who did not ever start them had better cognition 5 years out. So I do not recommend starting them. Now, there are recent medications that have hit the market, too much fanfare, some controversy. That are these are the monoclonal antibody therapies that are delivered by IV, and they are associated with brain bleeding and brain swelling. So these are the side effects that you have to be worried about. And as we've kind of gone through the process of having these, having these come out onto the market and having the research be published, what we've seen is that there's less brain bleeding and less brain swelling, but it's still a side effect. Those are still side effects that need to be managed. That means getting imaging, seeing doctors. Those are all very important. So Aduhelm or aducanumab, lecanemab or Leqembi, donanemab, I haven't even said that one out loud, sorry about that. But those are all these monoclonal antibodies that reduce, and you can see here, they don't improve cognition. What they do is they slow down the process of decline. And then RECODE, or the Bredesen protocol, actually gets us about the opposite. So about a 3-point improvement over the course of a year in the MoCA scores. So what you're getting is a 6-point difference between no treatment and getting on the Bredesen protocol. This is radically different. We're not talking about slowing decline, because many people who I serve as a doctor, a coach, residents at Marama, if you were to ask them or their families, do you want to extend this process of losing your loved one to Alzheimer's? They would say, absolutely not. Why would I do that? And you want me to pay for that? That's crazy. What we want is an improvement in cognitive function, an improvement in quality of life, and an improvement in cognition and connection and everything that's really important to us. And that is what we are seeing with the early studies of the Bredesen protocol. Now, I want to be clear as we kind of set the context for this, that that there's a very healthy criticism that there isn't enough research around the Bredesen protocol, that there has not been a randomized or controlled trial. They are recruiting for one right now. And Tyler, if you wouldn't mind putting that in the chat, the link in the chat, that would be great. So if you're in certain areas, you can be enrolled, or you or your loved one can be enrolled in that study. So it is coming. But the context there is that Dr. Bredesen has had funding for doing these trials for over a decade, but he was rejected by IRBs because they weren't willing to approve trials. The IRBs are the internal review boards, who are there for a purpose, and as they should be, to protect vulnerable patients and human subjects, including those with dementia who are very vulnerable. I fully support IRBs. And yet there was an emphasis on single interventions, on these randomized controlled trials, of course, but also on just one single variable. Whereas what we really want to study is, what do we do? What happens if we if we pour everything into it? If we do everything that we can to support cognition, what happens? Well, that's a trend that's happened over time, that we're going in that direction. So Dr. Bredesen wasn't even approved by an IRB until I think 2016 or in 2017, when his book was published. He was still being rejected by IRBs. So this was a very challenging time to not be able to get through that. And that's part of what's delayed this. My trial was funded in 2019, and we just published in August this month, in August of 2023, we just published the findings, because research takes a while and it's foundational. We have to do the feasibility trials, and then we do the randomized and controlled trials. And that is now happening. But yes, we don't have billions of dollars of federal funding, or even we don't have all of the funding that's going to come from pharmaceutical company that has billions of dollars to make on the other end. This is not something that can be patented. This is really about lifestyle change. There's some really phenomenal questions coming in. Olivia, we will definitely get you the link to the JAMA article. Yes, I have it open on my computer, so I'll grab that. And then MoCA is a better indicator of cognitive impairment than an MMSE. I would agree with that. For a comprehensive cognitive exam that's better than a MoCA assessment, do it by a neuropsychologist. So I agree, the neuropsychologists, they do much more intense workup. However, it doesn't change my treatment plan. And most of my patients find it extremely stressful. So a MoCA is a very low invasive, not a very invasive way to get what I find is a lot of information. So we compared the MoCA to the Cambridge Brain Sciences, which is now covered by Medicare. It wasn't when we did the trial, but Cambridge Brain Sciences is a battery of testing that you can do that's relatively easy, relatively inexpensive. Medicare is reimbursing for it. So you can get it through a lot of doctors. And it's much more granular, and it matched the MoCA every time. And so it really made me feel like I could rely on the MoCA to give me pretty good quality data, which is essentially free. You just have to pay the tech to do it. It's a free PDF, and it's not as stressful. Cognitive testing is always stressful for most patients, but it's much less stressful than a 2 to 4 hour neuropsych workup. So if it's going to change your treatment, then that is worth considering. But just because it's, I don't know that I fully agree that it's much better for everyone, Susan. I appreciate the insight and the perspective. So thank you for saying that. I think that it's up for debate, but I don't tend to push my patients to do that. Now, things like seeing a neurologist and doing some imaging, making sure that there's not, bleeding or a mass or a lesion or something that can be dealt with, by conventional medicine, that is really important. It's important to get that type of workup. But if what you're being told is, sorry, there's nothing I can do for you, see another doctor. And then from Joseph, the MIND diet. Yeah, this was a shocker this week. This was wild. So the MIND diet, which a lot of people thought would prevent cognitive decline, showed no change in a group over 3 years on that MIND diet. And that was published in the New England Journal of Medicine just this week, and wild to me. I would have expected something different, but it is interesting. We use the ketogenic diet and we see improvements in cognition, and there's certainly trials, not as big as the randomized controlled trial that was just published in the New England Journal of Medicine, but it'll be interesting to see what plays out with a ketogenic diet. diet, I suspect we would get better results than the MIND diet. The MIND diet limits salt, which worries me because I think elderly people run into the risk of mineral depletion. I don't think that you should be having a ton of table salt, but having enough minerals is important. And then also there's quite a bit of a processed food in the MIND diet. They're recommending sandwiches and like occasional ice cream and stuff like that. So I suspect that maybe had something to do with it. All right, so I'm going to get to questions. Sorry, I love this stuff. And so it's really fun. And I want to just talk to everyone forever, but let's keep going. Okay, so this is iodized sea salt. I gotta put the chat away because otherwise we're never gonna get through this. I just want to talk to all of you. Sorry. Okay, so Alzheimer's is optional. This is where I have come to conclude after seeing patients, residents, coaching clients. It was so fun. We had coaching clients this morning, brand new group. And in the group, I hope some of you are here, but if people were telling me before they even started coaching, just from reading Dr. Bredesen's book, getting signed up with Apollo, working with a doctor who understands this, there are already people experiencing benefits. And now they're coming to like put the icing on the cake and get more benefit and more benefit. And I just am so excited about this because so many people are suffering unnecessarily, and it's all of you showing up here to learn more and do more that are going to stop this tsunami of baby boomers who are about to approach that really high risk age. And so, okay, the research. Dr. Kat Toops, Anne Hathaway, Deb Gordon, and Dr. Bredesen, and other people who were involved in this trial published this paper in the Journal of Alzheimer's Disease about a year ago in July of 2022. And what they did was they took 25 participants with MoCA scores over 18. I believe it was 19 and above. And they did a 9-month intervention that included health coaches, plus the doctors, all the testing, IVs, supplements, medications. They did bioidentical hormone replacement. And then they had exercise coaches as well. And 21 out of 25 of those improved. One of them had no change and the rest of them declined. That's 84% of these participants improved their cognition. That is wild and better than any drug on the market. And so this is the first of a feasibility trial showing that early cognitive impairment can be improved. My paper that I published with my research group, HealthGuide, colleagues of mine, Ryan Bradley, Nini Callan, John Phipps, and Ram Rao from the Bredesen team all helped me to get this paper published in the Journal of Alzheimer's Disease, help us to do this research at my clinic. There were 23 participants, so very similar to the Toops paper and the Bredesen trial. We had 23 participants instead of 25. But we took participants with MoCA scores that were lower, so more severe cognitive impairment from 12 to 23. And we did a 6-month intervention. So I designed this trial based on what I was seeing in my practice. I saw that in my clinical practice, people with MoCA scores at these levels were getting better. And I think Dr. Bredesen was like, who are you and how do you have the audacity to do this? But I was like, this is what I'm seeing. Let's test it. Let's do the science. And we did a 6-month intervention. They did a 9-month intervention. We did 6 months with people who had more severe impairment. And what we saw is that about 74% improved. And that's 17 out of the 23 participants. And these are the MoCA scores. So you can see each of the 23 participants is represented by a dot here. And this is baseline MoCA scores compared to 6-month MoCA scores. The Cambridge Brain Sciences told a very similar story. What we see is a statistically significant difference in the mean scores when you compare them from baseline to 6 months, and it's improvement, right? And what you would expect is that after 6 months, you would have about 1.5 reduction in those MoCA scores on average. But what we saw instead was an improvement in that time. So again, this is radically different from the medications that are on the market that slow the decline process. This is an actual improvement in cognitive function in just 6 months. And so you see that not everybody got better, right? There were some people whose MoCA scores fell. And so it doesn't work for absolutely 100% of patients. And I wouldn't suggest that. And also what we see is that when people fall off the wagon, when they stop doing it, and this is part of why I say there is not a cure. It's not a cure. It's something that needs to be treated and managed with treatment. And you have to stay on it. This is a lifestyle that you commit to. And so what does that look like? What happens? What are we doing? We're talking about foundations of brain health. This is the intervention. We're looking at the environment and making sure it's a non-toxic environment that's set up to support cognitive engagement, socialization. We're supporting an organic ketogenic diet. We're supporting brain engaging activities, stress management, connection, creativity, and then the medical treatment and management of toxins, infections, hormone replacement, nutrient replacement, and all of those things are very critical. But those foundations of diet, activities, environment, stress management, sleep, these are crucial to getting the medicine to work. So the Bredesen 7 is another representation of what we're doing, of this intervention. And that includes nutrition, exercise, sleep, stress management, stimulation, those activities, the detox, the supplements, with all on a bed of mindfulness, right, which I love. And then that creates neuroplasticity. So this is another way that this is represented. Now, I could talk for days about what this all means. And so I want to get into some questions, and I also want to share a little bit more about the Clear Mind Center. So I've chosen to partner with this group because we want to get access to what we have at Marama, what we have at the clinic. What the Bredesen approach is phenomenal, and it works the majority of the time. The thing is that we need people to do it, and it's challenging. It takes a lot of support. So I recommend, getting the support that you need, whether that's from Apollo or through us. And I want to share that we have additional support available in Kansas. We've only had Marama here in San Diego for 3 years, and for about a year and a half, almost 2 years of those, we've had a waiting list. We've had to turn people away. And so I was looking for creative ways to partner with people to make this available in more places. At Marama, we've had people moving here from Georgia and Florida and New York and Ohio and the Carolinas and Hawaii and Washington and Canada. And so my goal is that there's a Marama in every city, so that you don't have to visit your loved one across the country, but down the street, and you can see them more regularly. So I chose to partner with Chance and Matt at the Clear Mind Center in Wichita, Kansas, because of how dedicated they are to the people they serve. They're doing a phenomenal job, and they have gotten many, many, many awards. We have lots to learn from them about being the best in class in senior living. And they felt excited to learn from me about how to implement this Bredesen protocol in an immersive setting, in a senior living setting. And for me, this is like, it's not rocket science. You just take the best in the science for people who need the best memory care, and you put it in the place where they live, and you combine those two things and miracles happen. It's really phenomenal. So I wanted to just share a few pictures of activities happening at the Clear Mind Center. They're getting the V-light using the red light therapy, which is very research backed, getting exercise, getting that cognitive engagement, and getting the support of others, being there in community. As well as, these are the rooms. So the rooms are well decorated and really fun. And there's a little welcome basket that comes so that you don't have to think about, oh, what toothpaste do I use? What soap do I use? It's all there for you. And we've done what I think is a good job curating those things for you so that it's non-toxic. And then this is a quick video that I'd love to show you of the Clear Mind Center that they just put together today for us, which was so sweet. So hopefully this will work. They're doing saunas, red light therapy. You can see the contrast oxygen therapy, all the exercise equipment, and they're doing it there together, spending time outside. So really fun. Thanks for letting me brag about how awesome they are. This is Christine. She also moved into Marama in 2020. And because we're brand new in Kansas, I don't have great stories from Kansas. Although one of the ladies who just moved in there, she moved back in, she was at Marava, did phenomenally well. Her son was like, okay, she's doing great, let's move her home. And she started to decline, unfortunately. They weren't able to keep the program going. And he was traveling, and they tried, getting her into a memory care facility close to him. And she continued to decline. And so she moved back in, but in Kansas, because that's closer to them, it's an easier flight for them. So she moved back into Kansas last week, and we're really excited to turn things around for her, get her improving again. She's just the sweetest, kindest woman ever, super intelligent, really, again, inquisitive and lovely and wonderful to be around, so loving. And so we're delighted to have her back. And it was really a testament to the power of what Marama does, because she came, she got better, she left, and unfortunately she got worse. I wish that didn't happen. But she was only there for, I think, 6 months maybe. And so we didn't fully get better. And again, it's not a cure. It's a treatment. It's a way to manage and cope. And what I would prefer is that everybody do this at home. But Marama and the Clear Mind Center are there for you if you want you or your loved one to be getting the best in class and an immersive experience where we've done the work for you. So this is Christine, lovely, lovely woman. She moved into Marama in 2020, and her daughter has been so inspired. You might have seen Momi. She was on the summit. So if you watched any of the summit, I interviewed Momi because Momi watched her mom transform. She watched her light up, her pain was reduced. She was way more energetic, much more engaged in conversation. She just did so well at Marama that Momi was inspired to open her own version of Marama, and she's working on doing that in LA County right now. So we're really excited for Momi, very supportive of her work, and just delighted that she's been so inspired to continue to spread Dr. Bredeson's story, this story, her mom's story, and make it real for other people. So if you are at all interested, please go to maramaexperience.com to apply now. Many of the people who are approaching us are daughters who, again, they want this for their parent or for potentially someone looking for their spouse. They want them getting the best in class, the best science applied to their way of life, to their lifestyle. And if you're looking for that peace of mind to know that your loved one is getting the best experience day to day, we have a few spots left in the Kansas facility. And so I want everyone to know about that. I don't want anyone to miss that chance to see their loved one get better or to get better themselves. And so we can reverse Alzheimer's together. This really is a community effort, and I'm so grateful that you are here. So what will happen is that if you're interested, you'll apply, and then at maramaexperience.com/apply. Tyler, if you would throw that in the chat, that'd be great. And you'll end up on a one-on-one call with Carrie, who's lovely. She's our director of operations over there. And what we want to understand is your unique situation. Is this going to work for you? Is it going to work for us? Are we able to take care of you? Here in San Diego, we have a lot of stairs. So there's people who have walkers and wheelchairs, and it's just not a great fit for them. But in Kansas, it's really wonderful because they have a single story, and each room has its own bathroom. And it's just this really, you also get that Midwest kindness. It's just, every time I go, it blows me away. I had the lovely opportunity to go and train everyone there a few months ago. I think it's back in May. And it was just that Midwest kindness is so heartwarming and so sweet. I left my car keys, my own car keys, my Prius car keys at the airport in the drop box instead of the rental car keys. And the woman ran after me. She texted me, called me, she was emailing me, and it's after midnight. I was flying back, and she tracked me down, came to TSA, and exchanged car keys. She probably really wanted the rental car key back, but I couldn't believe that. Where else other than Wichita, Kansas, would someone be that kind? And that's what we see in all of the staff, just expressions of that over and over, where they go the extra mile, they do that extra thing, they go out of their way to make it easier for you. And they smile, and they're just so engaged and wonderful. You saw in the pictures, Alex, who's our activities coordinator there, and he's just so thrilled and enthusiastic about what he's doing there. And the ladies love him. It's really sweet. It's so fun. He inspires them to get up and jump on the trampoline and do their extra rowing or whatever it is he's got them up to. It's really awesome. So we only have 3 rooms available as of today. So please apply. Let's see if this is a good fit for you or your loved one. We still have, for what we promised was that these first rooms, there's 14 available, and the first 14 rooms, we would offer a discount, a $2,000 discount through September 1st only. After September 1st, this discount goes away. So it's a $5,000 community fee instead of a $7,000 community fee. So if you or your loved ones are thinking about this, if you're considering it, please get in now before this fee goes up and before we fill. Really, I expect that we will have a wait list by the end of September. And so I want our community to have the benefit of this, to get the most out of the Bredesen protocol possible. And this is a picture just from this season of a little lake right outside of the Clear Mind Center. So there's a dock, and sometimes they go out there and fish. It's really sweet. And you can walk around the lake. It's just absolutely lovely. And again, there's a little fountain right outside. So take advantage of this. Don't hesitate to throw in an application if you're interested, or if you just want to have a conversation with Carrie, understand if it's the right fit. That's what we're doing. That's the first step. So please send in an application now. And then, after that, the application looks like this. So you just fill out a couple questions. If there's anything you're unsure about, you can just leave it blank. But let us know a little bit about you so that we know what's going on and how we can help you best. And then again, you'll chat with Carrie, and she is a partner. Really, we're looking to partner with families to make sure that we're a great fit, that you're getting the help that you need, the help you deserve, so that you can get the most out of the Bredesen protocol. And the Clear Mind Center, Carrie's actually going in a couple of weeks. So we train them all, and we're in very close contact with them, making sure that they have the support so that they can not only be a best in class in senior living, but in this Bredesen approach. So really exciting stuff. Thank you for your care and your dedication, your time, your love of your loved ones, of your brain health, and your attention, your perseverance. This disease is awful, and it's only together that we're going to work towards this goal of mine, which is changing this narrative around Alzheimer's. So I am going to stop sharing here and jump into the Q&A. I'm so excited because I feel like we're already having this phenomenal conversation. Okay, so from Frank, can dementia Alzheimer's be halted or paused at the current level, preventing a worsening of the disease? Frank, absolutely. I have no question. The answer to that question is yes. Can it be? Yes. Does it take work? Yes. It requires work. It requires effort. It requires resources. And so how to do that is, there's lots of different ways, but the first step for a lot of people is reading Dr. Bredesen's book. And I have a book coming out. I just turned my manuscript into my editor last week on the 15th. And so Dr. Bredesen is a neurologist. He gets into the nitty gritty, the science. He really gets into the story of what's happened. And this was published in 2017. My book is really, the way I think of it, it's a how-to. It's a how-to manual. Everything that we've learned from Marama, from working with my patients, from working with my coaching clients, it's how to apply the Bredesen protocol in just the direct, like, here's a recipe, have this for breakfast, do this after, go for a walk after breakfast, do a meditation after that, get a creative activity in after that, and here's some ideas for each of those things. So that's my goal, is that book will become like just a how-to manual for anyone who is looking to prevent or reverse cognitive decline. Thanks, Olivia, for asking. If you would like to purchase my book, potentially when it comes out, just if you're on my list, you will get lots of emails, and we'll start recruiting for a launch squad. So I'd love to get feedback about the book, and we'll give early copies to people who want to be involved in that. So you'll get emails asking if you want to be involved in that process, as long as you're on my email list, which I think if you've gotten the invitation to be here tonight, then you should be on that list, and I will be so grateful for your help and just anyone's input to make that a better book so we can serve more people. So thank you. What are my thoughts on why doctors aren't up to date on the research? Is it too much money and keeping people sick? I guess the conspiracy theorist and the skeptic, or I can't even think of the word, but the critical and person in me, I'll think of the word. There's a word, probably some of you have it on the tip of your tongues, or you can share it with me. But The negative person in me says, yeah, it's because pharmaceuticals and insurance companies run medicine, and it's totally messed up and it's totally backwards and it doesn't serve people. It doesn't get them healthier. But there are plenty of doctors who are dedicated to their patients and are doing this. They're functional medicine doctors and they're doctors trained by Dr. Bredesen. And so look for them. They're out there and they want to help you. And the system doesn't support them, right? So many doctors are stuck in this. I only have 15 minutes. A cynic. Thank you, Jack. That's exactly the cynical person in me is like, yes, it's money, follow the money. But no, I think that really it's like doctors are in a rough spot. I have a lot of friends who are medical doctors. They've got 15 minutes with a patient. They don't have an hour and a half to ask questions. They don't have an hour and a half to explain these things and to talk about diet and nutrients and all of these things. Really, there's kind of two roles here, a health coach and a doctor, somebody who can look at the labs, interpret the labs, give you the personalized support and that precision medicine. And that's a skill, and it takes a while. I have the doctor who works with me, Dr. Stephanie Lund. We were having a conversation today. I mentor her on Tuesday mornings, and she was like, "It's taken me 2 years to feel like confident about seeing these patients. Like, I'm so glad that I had the training wheels on because it takes repetition, it takes time. It's really a different way of thinking about things. When you're looking at optimizing, you're looking at individualizing. It's not just a formulaic, oh, this medication for that symptom." And so it's a really different way of thinking. It's a complex system science way of thinking about health and medicine. And when we don't have doctors trained that way, the system is against them. It's not their fault. They're trying to do the best they can. From Elena, which level of symptoms, visible stage of Alzheimer's disease, is resistant to improvement on the RECODE protocol? Yeah, so I lose some confidence when somebody has a MoCA score below 16. It's just harder, but it is not impossible. And I will never tell someone that it's not worth it because I've seen too many people get better. Now, for every family, there's a conversation to be had, right? I talked to a patient recently, and his wife was my patient, and she has Lewy body dementia. She is combative. She doesn't sleep during the day, or she doesn't sleep at night. She sleeps during the day sometimes when he's lucky. Can be violent. She is very, very resistant to anything, and he is killing himself over trying to help her. And I think for him, it's probably not the best idea to try to force her into the Bredesen protocol. It's just, he can't be a martyr. He can't kill himself over it, right? So there's a risk-benefit analysis that's different for every family. It takes money. It takes resources. I'll be honest. These medications or the supplements, bioidentical hormone replacement supplements, the testing, though some of it is covered by Medicare, for the most part, there is a cash investment that has to be made. And unfortunately, it's not covered by insurance, although it should be. And I hope that some of our work will contribute to that being the case in time. But right now it's not covered. And so if you are deciding between paying rent and buying supplements, pay your rent, right? Like those are classic examples that I've seen where people are struggling to make really challenging decisions. And there is a different risk-benefit analysis for everyone. And whether or not it's going to work, there's a lot of variables that have to come together. I've definitely seen patients who have, there's multiple adult siblings, adult children of the patient, and they're fighting amongst each other. And I just think every time, your mom might be here for 5 or 10 more years, but you're going to have to live with your siblings for the next 25. Do you really want to ruin your relationship with them over this? I mean, and I don't know, I sound really judgmental saying that, but it's really a conversation that I think is worth having. And these are impossible decisions that no one should have to make them. And yet it becomes reality for a lot of people. From Sandra, can mold mycotoxins cause Alzheimer's? Yes, they can. And Dr. Neil Nathan wrote a book called Toxic. Dr. Nathan and Dr. Bredesen are my two primary mentors, both incredibly intelligent, caring, and amazing humans who I think are I feel so fortunate to know them and to be mentored by them. But Dr. Neil Nathan's book, Toxic, is well worth reading because it guides you through how to assess for mold, how to assess for it in your body, as well as in your home potentially, and also how to get rid of it. A glyphosate question: in as much as AMPA, amino methyl Glufophonic acid, the primary metabolite of glyphosate, is a glutamate agonist. What is the impact of chronic low-level exposure in probable neurotoxicity? Paul, that is a great question, and there's nerds among us. I love it. Stephanie, oh gosh, somebody help me. Stephanie at MIT, wonderful woman who wrote a phenomenal book that's on my shelf at work. Senef, thank you all, group effort here. Stephanie Senef has written extensively about glyphosate and how it is a glutamate agonist and how it can disrupt the nervous system because it takes the place, or glycine, sorry, it really takes the place of glycine. So it can cause proteins to misfold, neurons to misfire. And my clinical experience, the highest levels of glyphosate I have seen in people, when I've looked at them on testing, you can do urine testing for glyphosate. And when I see levels, so like my test usually comes back below 1. And many people will, if they have severe Alzheimer's, I've seen patients with severe Alzheimer's, severe autism, and also ALS, and they have had glyphosate levels at 7, 8, 9. The highest levels of glyphosate I have ever seen are in patients who are very, very sick. And how much research is going on comparing different diets and Alzheimer's prevention and slowing? Well, yeah, it's a very timely question from an anonymous attendee because the MIND diet trial just came out in the New England Journal of Medicine. So somebody else had a question about that earlier, and I don't know if it's open access. A colleague of mine sent me a copy of it. Ryan Bradley, my friend Ryan, sent a copy of it asking for my opinion. And so that's how I read it, but I'm not sure if it's open access. But if you look for MIND diet and New England Journal of Medicine, I'm sure that there is news out there about it, explaining it. And essentially what it saw was that the MIND diet does not prevent Alzheimer's or slow Alzheimer's. The organic ketogenic diet is what I have seen work best. Now, the Sherazais are another, they're a couple, a neurology couple, and they're proponents of a vegetarian diet. And so there are multiple ways, I think, to reduce the cognitive decline. And for some people, a ketogenic diet might be helpful. I recommend going back and forth between a ketogenic diet and maybe a plant-based diet or a Whole30 diet. And that's my recommendation. And I think we need more research, certainly. That's a big message tonight, is we need more research. Since I am a naturopath, what is my opinion about homeopathic remedies in general and specifically for Alzheimer's? So I am not a homeopath. So I do not know that much about it. We studied it because we had to in school. I wanted it to work, but I never saw it work. So I just don't use homeopathy very much. Dr. Nathan uses some. And so occasionally I'll use some Pekana remedies, but it's not really my area of expertise. From Rose, I have been reading about the benefits of bioidentical hormones for brain health. My mother has Alzheimer's. As a breast cancer survivor and having a BRCA2 gene mutation, can I safely use the bioidentical hormones or not? If not, what else can I do to protect my brain health? Rose, this is a phenomenal question. And with the paragraph that I have from you, my answer would be no. It probably is not best for you. I would worry that we would cause a new problem, cancer, instead of solving your brain health question. But this is certainly, you may want to look at your ApoE status and other genetics and see what your risk is potentially of developing Alzheimer's. Versus your risk of developing cancer. There's also, if you've had a prophylactic hysterectomy or a radical mastectomy, then potentially you could consider it with a well-trained doctor who knows what they're doing so that you can reduce that risk. And Trevor, do you have any trained doctors available in Canada, British Columbia specifically? That's, Trevor, great question. You're like the third person today to have asked that. And I know that there are Bredesen trained doctors in Bellingham. So I don't know how close to the border you are from Washington, but there are Bredesen trained providers in Bellingham. And I have to tell Dr. Bredesen that he needs to train somebody in Vancouver, because we get this question multiple times a week. So we are certainly on the lookout. And there is a gentleman named Bruce Hoffman in Calgary, who was one of the first doctors ever trained by Dr. Bredesen. And do I believe brainwave entrainment can help people with dementia other than just for stress relief? Thank you for all you do. Thanks for being here, anonymous attendee. Neurofeedback is, I think, what you're referring to, or what it's often called. I just haven't seen that much benefit. And my bias is that I've seen a lot of people get it, and it's very, Jan Finters, Bredesen trained in Vancouver. Woohoo, Jan, would you send Tyler an email, please, so we can refer people to you? I'm so happy you're here. Wonderful, wonderful, wonderful. Tyler, can we please connect with Jan? So the neurofeedback, I've just seen so many people spend a lot of money and a lot of time and not get benefit. So I'm sure there's a way to do it. I don't know what it is. I'm not trained in neurofeedback, but I've had neurofeedback practitioners tell me that it works. So I don't know. I hope so. I'd love to see that added if we can consistently get it to work. Nancy Goodman, please address if women who are 65 have been off HRT for over 10 years, should we go back on an estrogen patch and progesterone for Alzheimer's protection? Some docs say restarting HRT with 1 or 2 ApoE4 could increase the risk of Alzheimer's, like Dr. Brenton in Tucson and Dr. Lisa Mosconi. Please help us if we're giving poor information 15 years ago. What can we do? So Nancy, in our trial, we did put people on HRT, even if they were 10 or 15 years postmenopausal, and we saw a lot of them get better. So the risk-benefit analysis is something you're going to want to do with a well-trained provider, but certainly in the past 15 years, there has been and even in the past year, there's been a very big shift in how we view the Women's Health Initiative study and taking people off of hormone replacement. Now, if you are on bioidentical hormones, it's very different. And then also there's a Finnish trial that looked at it was like 496,000 women, 500,000 women, and you actually reduce your risk of mortality from breast cancer if you start hormone replacement in your 50s, 60s, or 70s. So I think that there has been, and there's also a reduction in all-cause mortality, a British trial that shows a reduction in all-cause mortality with the hormone replacement. Now, you'd never want to do oral estrogens. You mentioned an estradiol patch. I think that's really important. Progesterone, you never want to do progestin. You want to do progesterone, bioidentical progesterone, and bioidentical estrogen. And you may think about bias, which is estradiol plus E3, E2 plus E3, which you can do as a cream, but a lot of people like the patches. Work with your provider to make sure that that is the right thing for you. From Carol, my husband was at home now in assisted living. His last MOCA score was 19 out of 30. He refuses to wear hearing aids. Oh, he's like my uncle's, it's the worst. He has severe bilateral sensorineural hearing loss, excuse me, ooh, that's a mouthful, identified in 2016 before his Alzheimer's diagnosis. He's never eaten veggies or leafy greens. He doesn't like the taste. So your question, how much healthier do you want me to be? Lucky to wake up breathing. What do I do? We have a great relationship. Oh man, this is the hardest, right? It's like, you just want someone to take care of themselves. And there's only so much you can do. There's just a refrain, a mantra, if you will, Carol, that I would offer: connection over correction. The most important thing for him is that he knows you love him and that you're connecting. Because if every time he sees you, he feels like you're correcting him in terms of what he eats or what he wants to do or sleep or how he's being, with the decisions he's making, he's going to just feel less than. He's going to feel disconnected from you. And I think the most important thing that you can do is just love on him at this point. If he's not going to come around to it, take care of yourself, do the Bredesen protocol for yourself, because this is stressful. And I kind of agree with him, be grateful for every day that you have together, and focus on the most important thing, which is connecting and enjoying time together and making memories together, even if he doesn't get them and he doesn't hang on to them. Do Marama clients, are they able to return to independent life? So that's the goal, Elena. That is certainly the goal. Our hope is that they do. Now, the earlier they moved in the disease process, the higher my confidence is. And we have had people move home with much better cognition and continue living the lifestyle at home. And we have support for doing that. We send them home with recipe books and other support. So that is the goal. A lot of times people, no one wants to move to a memory care facility, right? Like, who wants that? Nobody wants to move across the country and pay a bunch of money to live in senior living. The preference is to stay home. So most people come to us when they're more desperate, they're more declined, and that makes it harder. My hope is that we can have people moving in who are earlier on in the disease process. We get them back to fully functional. They learn to do everything at Marama. That is how it's designed, is that you learn to cook, you learn to do all the exercise, you get everything set up in your house, and then you go home and you do it there. And then you get to be with your grandkids and your great grandkids and, engaged in your church. That's really the goal. It doesn't happen for everyone. And, I shared with you a couple of the women who have been with us since 2020. Part of the reason is because both of their daughters were like, well, why would I take them out? Where are they going to go? There's no place that's going to be better where they're going to continue to get better. And it's easy. They're ingrained in the process and they're in the routine, and really the best place for them continues to be Marama. So with Carrie and myself, the other doctors that work with Marama residents or Clear Mind Center residents, we're constantly reassessing with the family members, with everybody who's invested in the health and well-being of your loved one. Is Marama or the Clear Mind Center, is that the best place for them, right? And this is a continual dialogue. It's dynamic, it's changing for everyone. And so all the time. And sometimes the answer is yes, and sometimes it's no, but we are, we're committed to doing the best thing for that particular individual. How many facilities like Marama are there? There's 2. And will you try to start a franchise or start many others yourself? And what can I say to a nursing facility to get them to adopt more of your practices? Oh, I love this question. Okay, so what can you say? Just ask, please ask. If you are in a position of considering a nursing home for a loved one, call them and ask, do you have a brain healthy diet? Do you have activities available that are going to engage my loved one? Do you have enough staff to facilitate that? Can they bring their V-light with them, their red light therapy? Will you help them with it? Ask these questions, because if the consumers are asking for it, whoever the vendors are going to figure it out and make it available. So the more you can ask, the more this is going to take hold and get traction. So please, please, please ask. And you can give them the End of Alzheimer's book, the Bredesen books. That's a great start. And some facilities will be willing to do it and others won't. We have facilities that call Dr. Bredesen and ask him about how to implement it. They call me. And I'm not exactly sure what we'll do next, but we're certainly exploring the idea of franchising or partnering with people who have existing senior living facilities so that we can widen our impact. Certainly that's the goal. How helpful is craniosacral work with Alzheimer's? I don't know, but I am a huge fan of craniosacral personally and professionally. I refer people to it a lot. I really love, James Jellis has passed away, but he was a craniosacral proponent, and Neil Nathan got to train with him. Many of my favorite craniosacral providers, mostly osteopaths, were able to train with him, and he really set the standard for training providers and providing really high quality craniosacral work. So you can have massage therapists who get like a week in class in craniosacral, and then you have James Jellis trained craniosacral providers, and they're in a world of their own. They are just phenomenal, and certainly help me with my health issues. And I am a huge proponent of that, but get a good provider, because not all of them are created equal. From Dirk, what were each of the important elements from the naturopathic medicine and functional medicine that came together synergistically to provide effective treatment for Alzheimer's and other dementias? Yeah, so it's all in Dr. Bredesen's book, and it's a lot. But essentially the way I think of it is that there's 5 things that cause imbalance in the system. In a complex system, you have imbalance is what's going to throw things off, right? So too much, too little, in the wrong place or at the wrong time. This is how I put this is my mental model of it, because it gets complicated very quickly, and it's not simple. It really is a complex disease, and it's a complex system. So we want to think, where are the imbalances, and what imbalances are causal, not downstream. Like thyroid's downstream. The thyroid it's not the thyroid's fault. It's not the immune system's fault. What is throwing those systems out of balance? It's going to be too much, too little, in the wrong place or at the wrong time. It's going to be too much toxicity or too little in the wrong place, right? If there's too little going into the liver because it's all stuck in the brain, that's too little toxicity somewhere, right? So it's imbalances in toxins, nutrients, stressors, structure, or infections. And then signaling comes in there too as we age. Hormonal signaling is usually an issue, but sometimes that's downstream. A lot of times we can maintain hormonal signaling if we have the right stressors. If we get enough exercise, we keep the testosterone levels high enough. So the way that's my mental model of it, Dirk. It's a lot to bite off. It's not like here's a pill or here's a IV. I wish it were that simple, but it's a little more complex. And I think the Bredesen book is the perfect place to go to really dive into that. Jack, I understand that prevention as early intervention is as possible is ideal. Yes. Is there a point where there is too much damage or cognitive loss to really get improvements? So again, I've watched people with MoCA scores of 0 get better. They don't necessarily go back to work, but they improve their quality of life. They go from nonverbal to verbal. They sleep better, they smile more, they're more engaged. So it really depends on your goals. If your goal is to get someone back from a MoCA score of 0 to 30, I've never seen that happen. But if your goal is to improve quality of life and cognition, even in someone with very severe dementia, I have watched that happen many times. What do I suggest for reducing anxiety? So I'm going to take just this one last question and then wrap up. But Penny, it's a great question. What we see work really well is the V-Lite on alpha. The alpha V-Lite, we have the NeuroDuo version of that, and there's alpha and gamma. Gamma is great for memory, and alpha is really great for anxiety. And even some of our staff will use it if they're feeling particularly anxious. And then there are supplements, things like GABA, theanine, taurine, magnesium, inositol. There's lots of supplements that can be helpful for reducing anxiety as well. And then, of course, meditation, the best medicine that exists. Thank you all for coming. It's such a privilege to be here with you. I couldn't just be more grateful for this incredible this really incredible community that's coming together, that's working towards this shared goal of making dementia rare and optional. And I just couldn't be more grateful for the support and enthusiasm and engagement from all of you. Thank you for staying up all over the world, for waking up in some places. I just am so grateful to you all. Good night.